I'm Dr. Erica Bove, and welcome to the Love and Science podcast. I'm your host, and also the founder of Love and Science, Thriving Through Infertility. I'm so excited you're here today. With over a decade of experience helping thousands of women just like you, I empower professional women to build their families with confidence and compassion. Let's dive in. Hello, my loves, and welcome back to the Love and Science podcast. I am so thrilled to have a friend and a colleague with us today. Her name is Dr. A.K., and that is actually short for Dr. Annahieta Kalantari, who goes by A.K. because her name is so long. But I met her at the Women Physician Wellness Conference in Grand Cayman, where she was also a speaker. She is a double board certified emergency medicine and lifestyle medicine physician, and she's also the founder of the Whole Human Health and Wellbeing. She built her practice based on the simple guiding principle that healthier living begins when lifespan aligns with health span. And this is this whole new term that I was not familiar with until a few months ago. She dedicates her life to helping patients to feel well on the inside through metabolic health, longevity principles, and hormone optimization, while helping them to feel good about how they look as well. And so welcome, Dr. A.K. It's so wonderful to have you. Thank you for being a guest on the podcast.
Oh, thank you for having me, Dr. Bob. I was very excited as we were chatting on the beach about this little collaboration. So I'm pumped. I'm happy to be here.
Yeah. And, I think just to kind of for the listeners, just to say, I think you were the first person I met at the conference because you were standing with the name badges and everything. And Dr. A.K. is just a force. This was a room full of probably at least 100 female physicians. And she just immediately rose, and maybe it's your Enneagram or something. I don't know. But you just immediately rose to be I am the leader. I am the force. I have the attention. Your presence is it's a commanding presence, but not in a scary way, in a way that's oh my gosh, I'm paying attention. What does she have to say? So I just wanted to kind of share that tidbit about what it's actually like to be with you in a room full of amazingly accomplished physicians in person.
Yeah, WPW is pretty awesome. So I feel blessed that I have the opportunity to be there and being around all those women. It's awesome. And thank you. I'm glad that I wasn't scary.
Yeah, that's right. And also, I love that when Erica Howe emailed out, she was like, this is a no blazer zone. And I was like, oh, thank God. I was like, if I ever do a retreat, which is on my bucket list of things to do for Love and Science, there will be no blazers. There will be no blazers. Oh my goodness. Okay. So let's talk a little bit about your story, because you like all of us, did the straight and narrow medical school, ER residency, practiced, academic ranks, all those things. And then you were like, okay, something is missing. This voice in your heart promoted you, right? Talk about academic promotions, but you had your own internal promotion to do something more. So can you share with the listeners a little bit about what that was like for you and how you made those decisions?
Yeah, I mean, I've kind of always been a very goal-oriented person, right? And I think a lot of us have, especially when we pursue high-achieving careers, pretty much everyone in medicine. Your goal is do well in high school so you get into a college that is reasonable. Then you do well in college to get into medical school. And it's just literally one goal after the next. And throughout my journey, I didn't really know about academic medicine. I went to a DO school, and that wasn't really something that was stressed a lot in osteopathic medical school. It was more patient care, patient focused, and not teaching and academics and research and all those things. So when that door opened, I was like, oh my gosh, I didn't know about this world. I had no idea about all this teaching. And now that became a new goal. And I went and I got my master's in adult learning. I was in residency leadership. And my kind of zenith goal that I wanted was to be vice chair of education of an academic emergency department. And I got it. And then there was another opportunity to become the DIO, which is the designated institutional officer. And you're basically the link between the ACGME and all of the academic programs at your institution. And I initially applied for it. And I knew that I was a really strong candidate to become the DIO. And I was talking to somebody and I was like, oh, yeah, there's a really good chance I'm going to be the DIO. And then I was like, oh, my God, there's a really good chance I'm going to be the DIO. And it was the first time in my career where I'm like, I, I don't, I don't want to do that anymore. And now that I've been the vice chair of education for 5 years, what else is there? And then I kind of
Mm-hmm.
just did this inventory of my life. Like, I haven't been around to see anything with my kids. My husband was doing everything. And there was actually a talk that I gave. It was a joke in the talk, but it also kind of revealed a lot about my life dynamic. There was an appointment on our family Google Calendar for the kids going to the doctors. Now, just to give you some insight, my husband and I are the same height. For a female that is tall, for a male that is short. And I'm always curious how the kids are going to land. I don't care what the ultimate result is, but I'm just curious because it's not, clear
Mm-hmm.
based on our heights going into it. And so I texted my husband and I said, hey, let me know what percentiles they are. And he's like, what are you talking about? And I said, like their height, their weight, and all of that stuff. And he texted me back and he's like, Anna, we are at the dentist. And it was like
Wow.
this wake up call that I just have no idea what is going on in my house. I've been
Mm-hmm.
so focused on my career. And early on, the kids were little, they didn't do anything. But then I started getting Mother's Day cards that were like, we know you love us, even though you're never home. Or
Oh.
I would get questions like, if you worked at a hospital closer, because where I was working and where I live is an hour and a half apart. And they're
Right.
like, if you lived at a hospital closer, would you have been able to come to my game? And I'm like, well, yeah, I would have. And then it was like one moment in the emergency department where this same dude would come in for congestive heart failure all the time.
Mm-hmm.
And
Mm-hmm.
finally, I sat down with him one day and I'm like, sir, what are you eating? And he was like, I eat healthy. And I'm like, you don't eat anything with extra salt in it. He's like, no. And I'm like, no, but like actually tell me, what are you eating?
Mm-hmm.
And he apparently was having a ham sandwich with a can of Campbell's soup, whatever, different flavors every day for lunch. And I was like, my God, there was no way that when he got diagnosed with congestive heart failure, nobody had this conversation with him. But at the same time, they probably told him so much stuff that
Mm-hmm.
he didn't absorb it all. This is where my education degree starts to kick in and with adult learning. I'm like, there's no way he knows all of that. And then there's no way for him to have the time to sit down with a doctor and do it. Like, yes, there are dietitians, but he didn't even know he needed to see one. And
Right.
nobody's telling them that. And nobody's asking the simple question. And it was after that, the same thing happened with this woman who would come in with DKA all the time. And it was just like all of those different things happening that I was like, I have to change stuff.
Mm-hmm.
I don't want to
Mm-hmm.
be a chair of a department. I really don't want to be promoted any more than I am. I'm starting to get bored with what I'm doing and I need a change. I actually kind of want to be a mom now too. And
Right.
so that was it. I ripped the Band-Aid off
How long
and
ago
then
was
had
that?
anxiety.
Yeah. 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 Yeah.
um I think the epiphany for me was February into March of 2024 is
Okay.
when it all
So
started.
fairly recently. I think that
Yeah.
the people listening to this podcast are mostly female physicians who want nothing more than to be a mom. And, based on the data, about half of my listeners, don't have any children yet. About half of them have a child and they're struggling with what's called secondary infertility. I know you know what that means. It means you have a kid and then you're trying to build your family, so far unsuccessfully. Some people also have recurrent pregnancy loss. And so, I see people all day, every day, especially in my coaching practice, who are miserable in their physician jobs, but they are like, you know what? It gives me the insurance for the IVF, and the IVF is so expensive. I mean, that's more academics, right? Academics is more likely to cover that, or maybe they're in a private practice and they feel trapped. And so, can you talk a little bit about like what you wish you knew to set up your life in a way before you are a mom to then be able to be as present as possible. And I'm in that situation too, right? Like people hear me tell my story of very grateful to have children. As you know, it wasn't easy for me at all, but my 10-year-old looked at me and he said, "Mom, where are you?" And I said, "Buddy, I'm right here." And he said, "You're here, but you're not here." And I was like, I had the brass ring job, I had the nanny, I had all the things. But I think that we are so short-sighted in medicine. Number one, because the system depletes us and it's intentional. We don't have any resources to like ask questions or negotiate, or, we just sort of, especially as women, people pleasers, we just keep following the crumbs until we're like, oh my gosh, how did it get so terrible here? But like for people who are trying to build their families right now in jobs that are really like sucking their souls, what would you have to say to them in terms of ways to navigate that conflict?
Hello, my loves. I am so excited to share this news with you. If you are a female physician navigating the fertility journey and you want a structured, evidence-based plan, I have created a free resource for you. It's called the Physician Fertility Roadmap. I have created a guide to help you optimize your chances of pregnancy and a successful outcome over the next 6 to 12 months. Check out the link in the show notes. Love you. Bye.
I didn't have a soul-sucking job.
Mm,
I actually really love emergency medicine. I still love it today. I don't love all aspects of it, but I really love that part of my life. I'm still picking up shifts in the emergency department. I did not love the commute,
mm,
but I loved my boss, the nurses, the patients, the residents. Like really, there was no "I'm sick of this and I'm done" kind of thing. But I think the one thing that I did throughout my career was I gave all of myself to my job.
mm,
And I kind of had this, I'm a Gen Xer. And we don't really question authority. We might flip authority the bird and be angry about it, but we don't really question authority. We do what we're told. We work really hard. We don't really ask a lot of questions. That's a cultural thing.
yeah.
As a female, I'm not a people pleaser, which, bit me in the ass a lot professionally. Like I would get in trouble with a lot of things a lot of times because I think people really wanted this communal person and they didn't get a communal person. And so that did cause problems for me. But even in that setting, I gave like every shred of my being to my job, which became a problem when problems did arise. Like
Mm,
I was at this one institution for a pretty long time and it was just not a good fit for me. It was not a good fit like 3 years in. And
mm,
I should have left, but I didn't. I'm like goal oriented. I had things I wanted to do. I was going to change the sepsis metrics. I was going to improve the education. I was going to help with the research. I was going to turn around the ultrasound program. Like all these things I was going to do. And I did do. And I gave so much of myself to that, that when things went south with that, I felt like a piece of trash. I just
mm,
felt like I was a horrible human. Um, I was depressed. I mean, I didn't live a very like hugs kind of life as a youth. There were a lot of challenges. Both of my parents came to the United States from Iran. There
mm,
was a lot of cultural shock for them, from there to here. And now they have this like very strong-willed, independent, daughter who will totally square off with them. And so it wasn't like I didn't have some hardships growing up. But even through all of that, I'd never been what would meet the definitions of clinically depressed.
mhm,
And so if I had one thing, I think, to do all over again, it would be to not make all of me what I do.
mhm,
Because that I think is really hard, especially for physicians. I can't speak to other professions, right? But I think in medicine, a lot of people are like, oh, being a doctor is your calling. You're so selfless. You're altruistic. And so you really identify like who I am. I am a doctor. No, I mean, you are. That's what you do for your profession, but it's not
Right.
like who you are. There's a lot more to that story. And I was very blind to that. But I'll be honest with you, Erica, had anybody told me that early on, I wouldn't have listened to them anyways, because I'm
Yeah.
one of these, like, I got to step in the poo to learn where it is and to avoid it in the future. I got to like do it myself. Um, but that is, I think, probably the biggest lesson that I
Mhm.
carried with me, like throughout my
Yeah.
career so far.
I think you're saying to just be mindful of how much we're giving and also where our identity lies. Is like if our
Yeah.
identity is 100% what we do, then yes, somebody even yesterday said to me like nobody on our deathbed is gonna like ask us about our work. They're gonna like ask us about our
Mm-mm.
relationships, and it can be our partners if we have partners, and hopefully children if this journey works out for people. But I think it sounds like you had a shift in perspective and priorities that then allow you to restructure your life so that you could live more in alignment with your values. That's what I'm hearing you
I mean,
say.
it really was. I said one time I woke up, I was like, who cares if you Google my name and it's like I I've given all these talks and I've won these awards. Like honestly, who cares? Like I know on my CV it's a big deal,
Yep.
but outside of that, who really cares?
Mhm.
My
Mhm.
kids aren't going to care. Like in 10 years from now, my kids aren't going to be like, well, my mom was, a speaker and
Yeah.
won. Like they don't care
Yeah.
about that.
Yep.
And it was definitely that forced epiphany of like, what am I don't want to do this anymore.
Yeah.
That I was able to finally open up and allow myself for a shift and a change.
Wow, and it takes some bravery. I mean, I think for our listeners too, like the fertility journey, like nobody expects to have infertility for the most part, and then when this happens, it's like, how am I going to be a female physician? How am I going to make it to my doctor's office every other morning for 2 weeks if I'm doing an IVF cycle? How am I going to have an egg retrieval when you can't even tell me what day it's going to be? You're like, yeah, it's going to be this week, but it depends on how your body responds. And I think one thing I love helping people to do is say, okay, you matter. You are a human first and foremost, which is doctors, especially in our generation, you just weren't humans. Like that was secondary. You deserve to be a patient. How can you prioritize this as the most important part of your life right now? And I have a client right now who was doing academic medicine and that, seemed like it was not allowing her to prioritize her fertility. And then she tried a different job kind of out, adjacent to clinical medicine. And that didn't seem to be the right fit. But I'm so proud of her because through and through, she's like, this is the number one priority for me, family building at this point, and nothing else is going to rock that. And I do think that that takes a lot of bravery to say, okay, this like for you, it was like, okay, I need to reorient to like being a parent, these kids that I really want, I want to be a different version of mom. And like there are these just like I did in the clinic, like there are these patients that I'm seeing over and over again and they're not getting better and nobody's helping them and like, thinking about okay, maybe I have a creative side. But I will say that, in my experience, when I started to coach more and do a little bit less clinical medicine, I had this like moment of panic where I was like, okay, who am I if I'm not like 1,000% a doctor? Like, and a lot, most of it was internal, but part of it was like, well, what are other people going to think? But I think being true to ourselves and to say like, okay, I have these unique gifts and like, as do you, and I have this contribution to the world. And, number one, having a purpose that is not just a doctor, but a healer, right? So like sort of zooming out and saying, okay, my purpose is greater than what I thought it was originally. Right. And then number two, okay, well, then what do I need to let go of identity wise to make room for something new? Yeah.
I I definitely had that shift. It was as my clinical shifts as, the vice chair were winding down, even months before that, I would cry
Hmm.
every time I would, have to tell people I'm leaving because, again, it wasn't under duress. I wasn't angry. It wasn't like I was running away from anything. And I think I was mourning a loss of this person that I was for so long. I mean, there were people in academic emergency medicine who were emailing me and calling me like, Are, is this for real? Are you actually leaving academic emergency medicine? Because I was so just in it. I was in it, so deeply in it, giving talks, doing all these things, mentoring, writing papers. Like everyone knew me. And now all of a sudden I'm leaving, right? So that I had to kind of mourn the loss of that professional person and then start to open myself up to other opportunities. And one of the things that I did find is the common thread in all of this is I am an educator, right? Whether it's an educator of residents, of patients, of junior faculty, whatever it was, I really love teaching. And I've always had this knack of taking these really complex different situations and breaking them down and simplifying them. Like the concepts that on paper you're like, what? But then I can kind of break them down and explain them a certain way. And so I think finding that unifying characteristic between what I did before to what I'm doing now helped tremendously. Once I was able to make that, like, I'm going to write a blog and teach people about lifestyle medicine, or I'm going to start a podcast and go through what are things that actually work and make you healthy, and almost become kind of like the anti-wellness influencer and educate people on a lot of this nonsense that's out there. I caught like that second wind, and that love came back. The whiteboard that I had in my office when I would teach residents, I moved to my office that I have now, and now I'm teaching patients. So having that kind of common thread was very helpful.
I think that's brilliant. And like, it comes back to that question of like, who am I? Right. And like, when you can say, okay, who am I at my core? And your deepest why is to educate, then everything else makes sense from there. And then you get to decide. And I also love what you said is that when you let something go, that thing that you were like, climbing and trying and actually very much succeeding at, sometimes we have to let some things go to make room for other opportunities that are meant for us. And so what were some of those opportunities for you that sort of came to be once you opened the space for them? If you're listening right now and finding yourself nodding along, this is usually the moment people realize that they want support that's specific to them. In addition to this podcast, I offer one-on-one fertility consults where we look at your full picture with both strategy and compassion. You can learn more in the show notes. Now, let's get back to the conversation.
I wish I had a really nice, clear way of communicating it. I've never been that. I've never been the like, let me sit down and focus and think and allow space for things to come in. It was kind of like, all right, I don't want to do this anymore. What are the options? Right. And then I went through and I looked at what are my options to continue being a physician, because I knew I still wanted to doctor. I just didn't know what kind of doctor. So I looked at the options that were available to me. I mean, I don't know that a lot of people know this, but once you go through residency and you graduate, there is no more funding. So for you to then go get another residency, that hospital is not going to get paid for you. And they're already working well over the cap that was set eons when that hospital was first started. So you're a financial burden to a hospital if you've gone through residency training and now you want to do more residency training. Besides that, I did not want to be a resident again, nor did I want to go be a fellow in anything. And so there were options like obesity medicine, functional medicine, palliative care. It's a year fellowship, all kinds of different things that I looked at. And the one that spoke to me the most was lifestyle medicine. And I was like, you know what? This is what I'm going to do. And I still didn't have a great plan. And the other thing, I was like, well, I'm getting older and I want to learn how to do all this stuff to my face so that I don't have to pay somebody else $1 million. And now I have time to learn more. So I kind of went down the lifestyle medicine route, the let's stick with the evidence route, and the aesthetic-y type of things that kind of made sense for me because I wasn't into like filler. I'm still not. And I just kind of made something out of the things that I'm interested in. And over time, it has reinvented itself. Even though I'm still relatively new in the grand scheme of a career, right? I'm like 1 year in my office. Even though I started everything
Right.
in March of 2024 was the LLC. I didn't
Mhm.
leave emergency medicine until December of 2024. I was doing things kind of telemedicine-y type things. And then in July of 2025, I got my office.
Wow.
So we're not even at a year yet. And even through that, there's a lot of reinvention and figuring out, what speaks to me and what doesn't. So
Mhm.
I don't know that it was necessarily saying no to certain things and mindfully making space. It's just that's how my brain works. I knew I was done here and I was like, you know what? I'm just going to have faith that this is going to work because it will. And I
Yeah.
planned for things. It wasn't like I just, didn't make any financial plans ahead of time and things like that. And, we get our benefits through my husband. So a lot of those things that I think a lot of people think about, I had some of those things set, but there are things that are out there for even people who are providing the benefits. I mean, there's catastrophic care, there's DPCs, there's all kinds of different models that are out there. So I think
Mhm.
just kind of exploring the options
Mhm.
and seeing what feels right is probably how I did it.
That's amazing, and that I think that, so many of us, like, were raised to just, like, always have a very concrete plan, and I think sometimes that can be very limiting, but it does, again, back to that courage and bravery, it does take courage and bravery to step out and say, "Well, I have, like, I have a fallback plan, I don't exactly know how this is gonna, pan out, but one thing I say every single day in my own meditations is I am resourceful, and when I look at my track record of other situations where I didn't know how it was going to pan out, it's pretty good. Like it's pretty good. And so, like, just like you, I kind of like lean on those previous experiences and remind myself, like, okay, Erica, you don't know exactly how this is going to turn out, but you know what your values are. You know who you care about empowering. These things. You're going to figure out all the details. And that reminder of like who I am as part of my identity as a resourceful person, that helps me. And I think that helps people listening to this podcast too, who say, okay, well, this job didn't work out. I'm going to shift to this job. Or, this insurance plan, I was talking to somebody yesterday who's like going to get a part-time W-2 for fertility benefits. Like there's all sorts of different things that people can get creative about, but just reminding yourself it doesn't have to look a certain way, that we can be resourceful. I did the same thing when I was thinking about leaving my employed position in 2022, right? Like I had somebody offer me a part-time job from Australia because here was me being like, oh, I'm limited. I have to stay in the Albany area, blah, blah, blah. There's only two practices, like all these things that my brain offered me. And I'm like, I have a contract from Australia. Like, is this really happening? It was somebody in my coaching group. And then I do think that we have to think about abundance and not scarcity. And when we can step into that, okay, there are opportunities I don't even know about yet. I'm gonna like open myself up to those. I say every day I'm a magnet for opportunities. Like again, we brainwash our brains with our brains, and I think it's so cool what you've been able to do with the lifestyle medicine. Yeah, it's
I
amazing.
I think it really comes down to being willing to step outside of your comfort zone and then being comfortable with the degree of discomfort.
Oh yeah,
Like
yeah.
though and I think that's kind of pan applicable, right? I don't know of situations where that doesn't apply. It's like I'm not happy here. I know I'm not happy. Well then let's go be happy. But then
Hmm.
that means big changes and being comfortable with the amount of anxiety, concern, the what ifs, the oh my gosh, if this then you go through all of these different scenarios in your head and at some point you just realize you make these plans and then life happens
Yeah,
independent of whatever it is that you're planning and
yeah.
just I don't want to say just like giving yourself into it fully, because sometimes life's plans are shitty, and I don't know that you need to give yourself into it fully, but just embracing the fact that these things are going to happen, you're going to experience it, accepting that it's a normal part of the process and
Yep.
that the journey is going to happen in the end. You will land. I
Yeah.
think you got through medical school, you got through residency, like you will land.
Yeah.
So that's
Yeah.
that's kind of what's always in my head.
So beautiful. What do you think about the intersection between lifestyle medicine and fertility? Like, you and I have had lots of conversations about diet and sleep and, especially for female physicians who are not necessarily taught how to prioritize themselves and take care of themselves. Everything's always about other people. What do you see in your practice that might be useful to our people who are on this journey, trying to live their best lives, trying to optimize their chances, but like know that there's a lot of forces against them that make it harder for them to do what they know they quote unquote, I hate the word should, but should do.
One of the things that I have found out in all of this is that medicine is so much more gray than we previously thought. Working in the emergency department, somebody comes in with pneumonia. It's very cut and dry what I'm going to do. There is an
Yeah.
algorithm there, right? But when it comes to so many other things about how we feel, there's no algorithm.
No.
And so
Mm-mm.
what I have found, the beauty of lifestyle medicine, there's 6 pillars to it. It is, I'm not going to say it exactly how ACLM says it, but in general, it's your nutrition, your movement, what are your stress levels, how are you sleeping, what
Mhm.
substances are you using, and what are those social connections? And they all overlap. Like, it's not like if you are eating really, really well and then everything else is trash, you're healthy.
Mhm.
And doing lifestyle medicine made me realize that this area of gray is among all of the connections of each of those 6 pillars. And you really
Mhm.
have to focus on all of them. My thoughts, and again, I have no paper to back me up or anything, but if we talk about the biology, our biology here on this earth,
Yep.
biology wants us to reproduce.
True.
Biology will allow us to reproduce when all ideal conditions are met or good enough to meet.
Yep. Yeah.
Biology isn't going to put excess energy into propagating the species if the situation doesn't align with the success of that species, right? And so this whole lifestyle medicine has opened up this whole new world to me in terms of how interconnected all of these things are, and how a lot of times in medicine, we can't quite put our thumb on exactly what it is. But if we just take the time to make small little changes in
Yep.
all of these little areas to optimize our overall health, it is
Yes.
amazing what the human body can do. And I think a lot of that overlaps with infertility if we're going down to the very basics of biology. Like, I know humans are complex. We're not the same as like fish or lizards or whatever, but if you look at less complex organisms on Earth, there are certain parameters with which they reproduce. And
Mhm.
I think if you cut back and just kind of get to the basics of humans and biology and reproduction, it really makes you think probably spending a little bit of time in all these different areas of our
Mhm.
lives to make some improvements are really going to have an effect. Like I said, I have no paper. This is all like my
No, no,
hypothesis. I've
no.
no data to support literally anything I'm saying,
Yeah.
which is hypocritical because my whole
No, no.
podcast is about data. But like, I
There are
really
data.
think,
There are data. There are data to support what you're saying. And I think about
okay,
like the journey
okay.
of the female physician with infertility. who is stressed out about infertility. We know that people with infertility have comparable stress and anxiety levels to people with cancer, who is not sleeping because they have night shifts and 36-hour calls as attendings, which are illegal as residents, but then attendings somehow play by different rules. And then they're eating graham crackers and peanut butter at the nurse's station because that's what they, can cobble together. And so, I personally think that stress is the missing link for doctors with infertility, most of them. I mean, sometimes the science isn't sound. We always have to make sure the science is sound, but the inordinate amount of stress that is involved with being a doctor, being a patient, having infertility, like I don't think this is just about oversimplifications about, oh, you just need to eat well, oh, you just need to reduce your stress. I'm not
Correct.
hearing that in what you're saying, because if that was the case, then I wouldn't have a job. Like that would just go away.
Yeah.
But I think that what I found is that infertility is never like one giant issue. Usually it's usually like some subfertility, some a little endometriosis, a little ovulation issues, a little male factor, and then you throw in sleep dysregulation, and you throw in maybe a BMI that's not quite optimized, you throw in a poor diet. And I always say it's about aligning the vectors. When we can align enough vectors such that, and maybe somebody even needs IVF, this is not saying everyone's going to conceive on their own at home, but when you can align enough of the small vectors to a place where it is good enough, that is what people need. And I think that's what you're saying is like, we need to integrate all these things. We need to focus on them. It is, simple but not easy. And I think sometimes it takes working with somebody like you to be able to connect the dots and, help people, over optimize, but not over optimize, to align those vectors in a way because you have the time and the experience to do so. It's just so beautiful.
Well,
Yeah.
thank you.
Yeah.
But the other thing that I think I just want to highlight with what you said
Yeah.
is there's something called the Kaizen effect. And this came out of Japanese manufacturing. I think it was World War I. It was one of the world wars. I'm not a historian. I'm not going to pretend to be. But what they found was that people went to the kind of the factory workers who were at the front lines and were like, hey, what do you need us to do to make this better? And what they found was a lot of these small little tweaks here and there
Hmm.
added up to have a profound effect cumulatively. And I think that's honestly all we need for our health. You do not have to be perfect in every aspect of your health. I think if you just make a small little tweak here, a little tweak there, and you make just these tiny little changes here
Yeah.
and there, the
Yeah.
cumulative effect is profound. And that's what I talk to my patients about too. Like they'll come in and say, I need to lose weight, or I feel like garbage, or this or that. And we never, ever, I'm never like, get rid of everything in your pantry, go buy a gym membership. You're not working out at all. You have to do 30 minutes a day of all of this stuff. Oh, this is your muscle mass. Go lift weights right now. That is not sustainable. When
Right.
you're not used to doing that, making these huge changes are hard and you're not going to
Totally.
stick to it. So I think just the tiny little tweaks here and there is all most people need.
Yeah, I think you're right. So with that, I want people to know where to find you so that when they listen to this podcast, you're like, oh my goodness, I really could benefit from this kind of guidance, this kind of support. Where can people find you?
Well, if you are in Pennsylvania and in Ambler, PA, you can come to my office. But for everybody who's not, I have a blog. It's called From Dr. AK's Desk. You
Yep.
did a really clever thing. You use the same name for everything that you do. I did not. I made life very hard. So my website is www.thewholehumanhealthandwellbeing.com. My
Yep.
blog is available on there. It's called From Dr. AK's Desk. I also have a podcast called No Filter Doctor that's available on every platform, whether it's Amazon, Spotify, Apple. You can find me on all of those places. And we talk about lifestyle medicine, health myths, and just the evidence that's out there because, my goodness, there's a lot of nonsense out there.
Totally. So what I'll do is I will put all those links in the show notes so that people can read your blog and find your podcast and all those things, because there's so many influence, even for those of us who are within medicine ourselves. There are so many unanswered questions and so many questions about like, what about that study? What about this study? What about this, exposure and all those things? And so people really do need to understand the truth, but we don't have all the time to like filter it out ourselves. So we will absolutely point people in the direction of those resources. Amazing. Is there
Well, thank
anything
you.
else you want to say today as a guest on this podcast? I've loved our conversation, Dr. AK.
I just want to thank you for the opportunity. This was really great. I think you are an absolute gem. So not only is it great to have another opportunity to hang out with you, but to do it in this way is very generous of
Yeah.
you. So thank you. I appreciate it.
Well, you know what, AK, like we continue to educate, we continue to empower. And just like I say, I love in science, we are stronger together. We are stronger together when we are the anti-influencers, right? When we are the anti-influencers on this path who are collectively trying to educate and empower the people who deserve it the most. So again, thank you for your colleagueship. Thank you for what you do. And I can't wait to keep making a dent in the world with you together. So yeah.
We'll chip it away together, girl.
That's
Thank
right.
you.
That's right. And to my listeners, you know how much I love you. Until the next time. Bye.
Thank you for listening to the Love and Science podcast. I'm so glad you joined us today. If you found this conversation valuable, if you could please rate, review, and share this podcast with your trusted people, it would mean so much to me. If you want more tools to help you navigate the fertility journey, please book a discovery call with me today. The link is in the show notes. Please do not let infertility have the final word. I'm here to take the burden from you so that you can achieve your goal of building your family. In gratitude, this is Dr. Erica Bove. I'm rooting for you always.